All right. Looks like folks have just about gotten in, but we may have a few people kind of filtering in as we start to chat. But first of all, I want to welcome everyone this evening to the Business of Health Career Networks program panel, Health Policy and Research. Thank you all for joining us this evening for the panel, which is part of the UNC Center for the Business of Health's Career Networks program. Career Networks is a constellation of resources meant to educate and create community around the continuously evolving healthcare ecosystem. You can explore the CBOH Career Networks platform via the URL pasted in the chat box. So I just pasted that in there. Hopefully everyone can see that. For tonight's panel, we ask that you turn your video on and mute your microphone while not asking questions. When you do have a question, please raise your digital hand and the panelists will answer your questions through the discussion. And raising your digital hand will bring you kind of to the front of our screen so that we can see that you have a question. I will also pause every couple of moderator questions so that the audience can ask questions as well. Tonight's conversation will be on experiences from multiple perspectives in the health policy and research space. I'm Susanne Killian, Associate Director for Student Engagement with the Center for the Business of Health, and I have Erin Leach, our Program Manager behind the scenes tonight. The panelists joining me for this discussion are Julie Hocker, Lindsey Haynes-Maslow, and Tony McDermott. I'll let the panelists introduce themselves. So Tony, take it away.
All right, thanks, Suzanne. Hey, everyone, good afternoon, or actually good evening. It's been a long day. I'm Tony McDermott. I am a grad of Keenan Flagler, and I work for a company called Therapeutics. And so what I'll do is today, I'll give you a little bit of background on my position from health policy perspectives when it comes to digital therapeutics, which is where I currently work. And then also I can give you a little bit of background on the view of health policy from the pharma side, where I spent about 10 years of my career. And then on the consulting side, which was also another 10 years. So pretty old at this point. But for my current company, Click Therapeutics, just wanted to give you a quick background. So we're a developer of software as a medical device. So essentially it's medical grade apps that sit on your phone, whether it's an iPhone or an Android. And these products can be used to address medical conditions, either as a standalone or in combination with pharmacotherapy. So some of the areas that we'll talk about today are going to focus on policy areas and policy points that are going to be impacting more of the pharma and digital perspective from my side. And then I'll turn it over to Julie.
Thanks, Tony. My name is Julie Hocker. I'm here in Washington, D.C., and I work for Guidehouse, which is a global consultancy. And our primary focus is on the public sector. I'm a director in our public health practice, and I lead our rare disease and disability portfolio across our federal and state accounts. Prior to joining Guidehouse 4 years ago, I was the U.S. Commissioner on Disabilities, so have significant experience inside of the U.S. Department of Health and Human Services, and I am a proud alum of Keenan Flagler with my MBA as well, and look forward to exploring tonight how we think about the intersections of business, healthcare, and the leadership inside of our federal and state agencies. And so I think that leaves Lindsey.
Thank you so much, Julie. My name is Lindsey Haynes-Maslow. I'm an associate professor and director of master's programs here at UNC in the Department of Health Policy and Management and our School of Global Public Health. And today I'll be talking a little bit about my current position as a master's program director and what we're trying to train the upcoming generation of healthcare leaders. But also I'll give you a little bit of background of previous jobs I've held in terms of working in the policy arena, mostly trying to focus on the intersection of where nutrition and food policy meets health policy, and then really talk about how you try to start communicating across, one, just even different levels of government, and then two, even just different agencies in government. Just in case anybody had a question, they don't all speak the same language, so we can talk about that a little bit more. But I'm also a triple Tar Heel alum, so I'm proud to represent 3 degrees from UNC. Sadly, Keenan Flagler is not one of them, but maybe, you know what, I do have time still, so we'll see.
Terrific. And people learn business in so many ways. So we are so glad to have this stellar panel tonight. And we had a little bit of a conversation prior because as I listened to everyone's journey through their career and their education, something that came up was that everybody has such a unique pathway to where they are now. And this isn't the last step they're probably going to be taking in their career. So my first question is, what steps did you take to land in your current role and career? And you guys can popcorn around, so anybody can begin.
Well, I'm happy to go first. I will say I am one of those people who one of the first pieces of advice I ever give anybody is your career is yours. You should enjoy it every single day. You're going to have hard days and days where you kind of end with an empty tank, but your career is a journey and an adventure to go on. When I left business school, I went into asset management for a number of years in Philadelphia, and it was a tremendous firm. I grew quickly and significantly in my career, but then got a call to return to Washington and become the U.S. Commissioner on Disabilities. And those sound completely unrelated, and in many ways they are. But one thing that has come through and been a thread that I have pulled through my career is one, helping people. So asset management allows people to plan for their future and invest in their dreams and their goals. And healthcare allows them to lead healthy, long, satisfying lives. So I always saw them as having people at the end of our goal. But I also saw the connections between the regulated industry that is asset management and the regulated industry that is healthcare, and actually being able to bring solutions that we built when I was at Vanguard into the healthcare sector to really kind of help drive that innovation. So after I was done my term as U.S. Commissioner, I actually came here to Guidehouse with some of my former colleagues. So we are still a band together, and we're taking what we learned at the federal level and helping our state clients, and I've retained a couple of federal clients as well. But I don't know what's next. And I think part of my goal is to just continue to be on a challenging, fun adventure in my career, and ready for what's next.
Do you want to go, Lindsey?
Yeah, I can just jump in. I was just going to build on what Julie said. I think it's really important to realize that in life and in your career, there is no one size fits all pathway to how did I get here today? What step did I take? Was it a sequential step? Was it a phased approach? I made, I think, very intentional decisions for the past 15 years, knowing that I wanted to end up giving back and making sure that I had my own values of doing good for a community and how can we actually use policy to inform ways to best serve, our community members and our health systems and the patient. At the end of the day, we're all patients. I think that's one thing that we have in common, very much so. So I appreciate that idea that you can decide one day that maybe this job is just not for me. And if there is a door open somewhere else, I think it's always really important to look down those doors, look down those pathways. But I will say it's a little bit ironic that I left UNC in 2014 and thought I would not be returning anytime soon. And I would love to say I've been back for 2 years now. So you truly never know where you will end up. It might be where you started, but you're just in a different place. And I'm enjoying working with our students that are, as I think, on top of what is most recent, what is relevant, what is interesting to them, because I think our learning processes are very much bidirectional. They teach us as much as we teach them. And so I think, this idea of working together to collaboratively, and then also just, pushing back and even, addressing what are our big, problems today and how I might view it as a solution or a problem. And that might be completely different from someone that is coming from a different background, culture, state, region. So I'd love to hear also what Tony has to say about this.
Yeah, I think two things that both you, Julie, and Lindsey said resonate with me. So, Julie, from your perspective, it's about relationships. It's about who you know. I will tell you that outside of the first job that I got, where I knew I wanted to go into consulting, but I didn't know what I wanted to do in consulting. Every job I got after that was a relationship where I knew someone was at that company and they opened a door for me, right? So developing relationships, networking is hugely important. Even now in my career, I'm over 20 years into my career, and it's important for me now because who knows where I'll be in the future. So that's one thing that I would say. And then Lindsey, you had mentioned something that resonated about more range and creating your own path. So I've very much taken a generalist approach, and the book that I've really gravitated towards is Range. If you haven't read it, definitely recommend it. And I feel like by building some specialized skill set, but also being a generalist, it gives you that opportunity to pivot into a lot of different pathways, and then also to take advice and mentorship, not just from the top, but also from your team members. So, I have a team of 4 that work under me, and it's very important for me to know what their perspectives are, because in a lot of times it's challenging norms that maybe I've seen in the past, but they're not going to work in the future. And that's really important, especially in sectors that are more innovative and more cutting edge and less defined, because you can't have that templatized view to build that business going forward. You need fresh insights, fresh perspectives. And so, having that range and that just adaptability is always going to be something that'll be key for you in the future.
Terrific. These were fantastic answers, and a few things that I heard that I just really think are great to pass along to anybody. First of all, the range. And it's funny, I just moved, that book was right under my desk like 2 seconds ago. But that, and also that I think Julie mentioned this, but things are related even though you don't know they are at the time. So again, really to look at relationships that way, but also to look at skill sets that way. Don't avoid, skill set building because you think, I'm never going to use it. You would be so surprised how you use so many of these skills that at one time you thought were unrelated or not worth your time. So again, fantastic advice. This leads us a little bit then to my next question, which is kind of talking about skills. So sometimes we can read things on the web, or we look at a job description that you need these certain skills. But I want to know if you can tell students, what are the real skills, abilities, and experiences that you use regularly in your career now and have up to this point?
I can start on that one. The biggest thing is, especially when you work in more of a matrix environment, is emotional intelligence. Just knowing the members you're working with, knowing their communication styles and how they work is something that's always going to be important, because it enables you to open up doors that weren't there before, in working with teams that are maybe having different skill set or different approaches to things. So that's one of the biggest things I see, especially working in more of a startup environment. Having that type of approach is key. I think from the other perspective is really having that attitude to accept new challenges and new problems. So working in a small company like Therapeutics, we have about 125 people. We're based in New York, but we have offices in a couple of different areas. To be able to have that more flexible approach of learning and adapting new skills is going to be needed, because even at my level, and like I said, I'm a little bit up there, just the ability to jump into new areas is key. And so having that flexibility, that malleability in your learning is one of the things that I found that is important outside of the emotional intelligence.
Yeah, and I would definitely second the emotional intelligence, and especially, in terms of healthcare, or public health, this sector in general, when it is about people, that is something where you have got to know, and you have got to be able to read verbal, and I will say nonverbal cues, and I give a heavy emphasis on nonverbal cues. So I know we're all in the Zoom room today, so you can't see all of my nonverbal cues, but I think that's something that people tend to really pick up on. Are you checking your watch? Are you looking down a lot? Are you kind of, are you fidgeting a lot? Are you actually just cold, but it looks like you are not feeling really comfortable in a room, but you're just cold because it's not the right temperature? But that emotional intelligence. But I think one of the skill sets that we look for, and I think anybody that is going into healthcare policy, health policy, is communication. Learning how to, one, recognize how you communicate, but then how do others receive your communication. So being able to tailor each way that you communicate to different partners, different individuals, talk to the people that have 15 seconds, say what you need to say and be done, and then maybe spend a little bit more time talking to people that are really trying to understand that issue. And I think in this day and age, when everything is, one, convenient and accessible for some groups, especially if you're on a college campus or in our areas, is if you can communicate, make sure you're communicating often and early, just so you don't ever surprise your colleagues, don't ever surprise your supervisor or your manager. I think that's probably rule number one. But I think that's really what we ask for now is, don't worry about communicating ahead of time. Just make sure that we're not blindsided by, oh, wait, we didn't know that someone wasn't available for something, and now we need to pivot our plan. So I think, yeah, I would just build on communication and emotional intelligence.
So kind of pulling on that one, I actually surveyed I had one of my rare disease teams in the office today, and I asked them this question. I said, what surprises you about what you went to school for? Most of them have masters in public health. We had a couple of PhDs in like biopharma. And there were themes, which was great. And I also asked one of the partners I work for, the number one thing that they said about being in consulting and about working in the healthcare industry was having a problem-solving mindset, being able to wade into ambiguity. And then they quickly attached that to being a lifelong learner. Not assuming that you or anyone on your team is going to have all of the answers, but that you're excited to go learn something new and to bring it to your hypothesis and really create that memorable, impactful solution for the client. They all said that without kind of that problem-solving mindset, they don't think they would be having the careers that they're building. We have an intern who's finishing up her MPH here in Washington, D.C. And she said, Julie, I had no idea that all of the analytics and all of the research that I was learning to do and all of the writing, that I would use it in consulting day to day. And she said, I'm so glad, because at the time when I'm in class, a year ago, it felt like I was never going to use these skills, and I'm using them every day in the work that we're doing. We're evaluating clinical trials, and so they are kind of in the weeds and in the kind of in the depths of the science at the FDA. The other thing that they told me was logic models and writing, being able to present their case and their solution well in various formats, and being able to pivot for the client, whether they wanted an infamous slide deck, or they want a logic model, or they want a beautiful memo or a report. Being able to tell that story and bring together data and stories to tell the client a compelling solution or idea was top of mind for them as well. So they definitely had some great answers, and sort of kept saying, well, you have to do them together and you have to bring them together. So I would say the last thing, and I think this pulls from what Tony and Lindsey were sharing as well, is feeling like you're carrying a toolbox of knowledge and skills and curiosity, and that you're pulling from them together instead of in silos throughout your day.
Just wonderful answers. And again, too, kudos to you, Julie, for engaging your team in discussions such as that, because I think that's important too, is to kind of, again, share with each other, as Tony mentioned, like, it's not only like, oh, I can only learn from this sage. You learn from your teams, from your peers, sometimes even from the folks that you mentor. So again, just fantastic contributions here. I'm going to open it up to our audience. If you all would like to ask any questions, again, raise your digital hand. If you can't find that or it doesn't work, just unmute and raise your regular hand, and we'll hopefully be able to see you. I'll scan through. All right, Dahlia.
You know, I have a question, Suzanne, as always. Hi all. Thank you so much for being here this evening. I'll share a little bit. Well, I'm Dahlia Namek. I'm a second year MBA. And I'll share a little bit of context for my question before jumping in. It's a little more towards like health policy and action, I guess, versus kind of like skill building, things like that. So, context, I have a lot of friends who are in medical school, and I learned recently from them. For example, one of my friends is currently a resident for cardiothoracic surgery, and I learned from them that there's only like 30 spots or something in the US for cardiothoracic surgeons. And they told me that it was dictated by Congress. And I was like, wow, that's huge. I didn't know that, Congress had that power, or it lies there. So that to me spoke miles for, the power of health policy in the US. So I wonder, that was a point of learning for me that really shifted my perspective. So I wonder, what is something that you have learned about health policy that changed the way that you look at healthcare in the United States, or how you approach changing healthcare in your position or potentially in a prior role?
I'll just jump in real quick. And I think that anybody that is interested in policy or health policy specifically, I tell them I am playing the long game. I'm not expecting to solve a problem in 2 months and 3 months and 6 months. I'm looking at 5 years, 10 years, 20 years, and I'm willing to commit to how do I make sure I build a base, and how do I make sure I have a strategy to what I'm trying to educate policymakers on. I am a state employee, so I'm going to say educate. I cannot advocate and I can't lobby. But I do think there's a very important aspect of just the recognition of and I think, Julie, you might have mentioned this earlier, there'll be some hard days where you have losses. And we intentionally talk about when I worked for an advocacy organization in DC, we planned for those losses. We essentially held campaigns and did congressional sessions where we knew we were going to lose, but that wasn't the end result. We said our basic premise for today is literally getting something on the agenda. It is literally having someone get a sentence out where that is a topic being discussed, maybe after dinner, maybe somewhere else. But I think being strategic and knowing what is a success versus what is a failure, and the idea that sometimes you are setting yourself up for in the short term to fail, knowing that you have a greater vision and you have a greater impact that you're looking at further down the road.
Yeah, Lindsey, just to build on what you're saying. So Dahlia, this is a great question. And so before I came to Click, I was working for a company called Vive Healthcare, which is an RTP. And we were launching our first provider administered product for HIV prevention. And so anyone that isn't in public policy knows the HIV epidemic is huge in the US for sure, but also outside of the US, especially in sub-Saharan Africa. And so we were developing the first product that would be provider administered for HIV prevention. And so this product could be dosed at a once monthly area. And typically HIV products are $0 copay, which is great, right? So from a prevention perspective, you're trying to stymie future growth of HIV. What we realized when we were starting our policy discussions was, because it was provider administered, it sat under a Part B as in boy benefit. And Part B did not reimburse for preventative therapies. And this was an act from CMS. And so what we had to do was scramble. Thankfully, we knew this ahead of time, so we had about a year to do it. But we had to develop a national coverage determination to allow provider administered products to be greenlit through a Part B benefit. And while we weren't able to do that at launch, it was about 3 or 4 months post-launch, we were able to get that covered at a $0 copay for Medicare. And the good thing was, it wasn't just for our product, it was for the category overall. So any products that were provider administered in the future would fall under that benefit as well. And so hopefully by providing that access and breaking down those barriers, you're able to maybe prevent growth of HIV in the future, not just in the US, but because of programs ex-US, hopefully doing it in other countries as well.
So I'll kind of build and circle back a little bit on what surprised me a little bit when I started getting into public policy. A couple of things surprised me, although I've had a few different jobs in Washington, D.C., and none of them have ever been on Capitol Hill, and that's a bit intentional. I don't necessarily love the policy-making aspects of Washington, D.C., and I think that one of the reasons behind that is because there's an infamous saying that says, policy and government can't love you. And that at the end of the day, the impact is always person to person. So there's an important role that policy plays, but I think one of the things that I have loved, and one of the reasons that I've been in and out of HHS and been around it so many times throughout my career, is that Congress gets to argue on Capitol Hill about laws. They often write imperfect laws. In some ways, that's because they've had to go to the mat and fight, and that means that they were compromising, and in other times it means maybe they were rushing. But the executive branch and what they do to carry out programs and the decisions that they make and the authorities that they have from Congress and the flexibilities that they have to execute the federal budget each year are tremendous. And so I would say that one of the things I encourage, particularly folks who are like, I'm getting my degree, I want to be in public policy. I often ask them, what does that mean? What part of advancing public health do you want to be a part of? Because there are many ways that you can contribute to that conversation. And I'll just give you one example of something that frustrated me in my last role that I have been trying to work on ever since, which is programs they operate in silos in the federal government. Their budgets, their authorities from public policy, what Congress allows the departments and the secretaries and agencies to do and not do are tremendous. And you need experts who can help you even understand what your job is when you have an appointment in the executive branch. And so if you want to be a part of taking policy and putting it into action and designing programs, making regulatory decisions, approving drugs, setting an education program about vaccines or diseases, or any number of other public health issues, or being a part of research and advancing the race to cure cancer, or in my case, being a part of finding cures for rare diseases that children are dying from, consider the other facets of the broader public health space, including the executive branch, or even coming and being a part of the research space, or the innovative and transformative space, or the consulting space, because Congress is the first stop. That piece of legislation is also just the thing that gets everybody else able to move.
Julie, I'll just add one thing, because we talked about it a little bit in the prep session. The states are also a big area for innovation, right? And so
yes,
while you may initially gravitate to the federal government, just know that from a state perspective, they have actually more opportunities for innovation than what you see at the federal level. And so especially when you think about those populations that may be adversely affected, whether you're talking about rural healthcare in states that are more expansive, or you're talking about states that have higher levels of poverty than other areas, focusing on breaking down barriers there, or maybe addressing issues that affect Medicaid populations, is a huge task to undertake as well. So I would definitely say, think about state in addition to federal if you're thinking about policy perspectives.
100%. Tony, being in Washington, D.C., I remind people that there's no way people sitting inside this beltway are going to solve problems for people in rural North Dakota, downtown LA, and in corners of Midwest Arkansas. There's no way. You've got to get out there. And I actually recommend to folks, like, don't work in the federal government until you've worked in local or state for that reason, for sure.
I feel like Probably just one quick statement, just a call out to local government real quick, and just even local decision-making bodies. I remember at one point in my life, I had thought about running for office, and I remember someone asked me, have you ever been a part of a PTA? And I said, like, the parent teachers at the schools? And they said, yes. And I said, no, I have not. I don't have children. And they said, go to the PTA, see how it feels, and then tell me how you feel about getting into those type of positions. So I would say, yes, I definitely look at your local, state, and federal policies, because depending on your issue and your topic and your timeline and your resources, you can work those different levels of government very, very differently, but also authentically in what works for your issue and your company and organization at that time.
I just want to say thank you to all.
And as always, Dahlia, a very thoughtful question. I love your questions, but thoughtful answers as well. That was just absolutely fabulous advice. So thank you so much. All righty, we have another question. So Joshua.
Yeah, so I have two questions. The first one is kind of for Mr. McDermott. It's because you said you had experience in medical device sales, and that's kind of something that I want to do. So, like, do you just have any like general advice for someone who wants to pursue that career, like in terms of like getting your foot in the door and like steps I can take to secure that? And then for everyone is like, what's your favorite aspect of your like day-to-day job?
Cool. So yeah, I'll take the first one. So just a point of clarification. So when I'm focusing on medical device, it's not so much sales, but home office areas. And so the area that I focus on is an area called digital therapeutics. And so coming out of today's discussion, if you like Google Click Therapeutics or the Digital Therapeutics Alliance, you'll be able to see what companies are doing right now in the way of innovating, whether it's diagnostics or digital products that either prevent or treat a disease. And so what I would say is the first thing is think through what excites you, right, overall. So within the digital therapeutics area, you have different aspects of the business units that filter into the totality of the company, right? So you have your engineer side, your product developers, your content designers, you've got science as well. I sit in a function that is focusing in commercialization, right? And so what we do is we advise on whether it's product development, clinical trial development, go-to-market strategies, and then post-commercialization. And then we also have business development teams here as well, right? So what I would say is take a look at those companies, see if there's something or a sector that excites you, and then just start networking on LinkedIn. There are hopefully there's not going to be anyone that will shut you down when you're asking for information on their company or career paths at their company. So I would say network early and often is key. I mean, we're based in New York, but I live outside of Raleigh, and so we have a small office on Fayetteville Street. I frequently get hit up on LinkedIn for conversations around the space, and I'm happy to do it, you know, especially for someone that's new or interested, because like we had talked about earlier on, this is a growing sector and we're not going to be able to do it alone, right? So getting new ideas, new influences in, especially if you're thinking about the post-grad area of work is beneficial for us. So definitely recommend being curious and starting a network on LinkedIn.
All right, I think there was a second part to his question as well for everyone, which I thought was a really good one. What is the favorite aspect of your day-to-day in your current career?
I can kick us off in consulting, where we are we are a client-driven sales business. My favorite thing is being in front of the client, working with them, truly understanding their problem and bringing a perspective and a solution that they couldn't get to themselves. I think that what consulting at its best is when you are able to bring a team of experts with niche backgrounds and very developed skills and experiences, and infuse new energy and momentum into a problem that's been holding them back. Right now, I would say Just like people don't have favorite children, I don't have favorite clients. But I am just loving the work that we're doing with accelerating drug and therapeutic approvals for rare diseases, because what we are doing is sort of augmenting and allowing the FDA to test a new path forward for accelerating those approvals. And with, our team designed that the pilot that is going on, and we're evaluating it and walking alongside of them to try different levers and accelerators. So it's awesome. We get to have a front row seat with the client, and it's invigorating and exciting. And in consulting, it's always moving. So if you decide that you don't want to do rare diseases anymore, you can go and move over to any number of other areas in healthcare, or something altogether new, and reinvent yourself. So that's an exciting part of it.
I love that aspect of reinventing yourself. I think one thing that brings me to my job every day, I'm not going to tell you how many days a week, but I love that it's actually unpredictable sometimes, and that it's unexpected, but I actually find joy, and I actually do like to problem solve. And also I like to problem solve problems that I am trying to figure out, is it actually a problem? Is it a problem for right now? Is it a problem for 6 months? Is it a problem for 6 months prior to the year before I started my position? So I think that's one thing, that knowing yourself and knowing what type of climate you like to work in, So my work environment, my culture is, I like my own hours. I will put in the hours. Don't ever ask me to say when I do those punching in, punching out times, but I appreciate that there's flexibility in it. But there's also just this, I'm always trying to figure out something that needs to be addressed or needs to be achieved. And I think at the end of the day, what probably brings us all together is that, if I can speak for the group, and you can totally say if you disagree, but I think we're hoping for impact, and we see that impact a little bit enough just to keep going, that it keeps us on this journey. And like you said, tomorrow I might change my mind and I'll be on a different journey, but pretty sure not tomorrow. But I do think it's important to make sure that you, at the end of the day, ask yourself, do I feel valued? Am I doing what I have in my core values in terms of what I feel like this world should look like? Who should have access to what, when, how, who's going to pay for it? So I think that's just one thing that I do find a lot of joy in this job.
Yeah, I'll just say from a last perspective, I like the unpredictability of the startup world. And, granted, I probably took a flip of what I should have done, because I've got a wife and 3 kids. I probably shouldn't be in a startup at this point. But I do like the unpredictability of the day to day. So in a role like mine, in a company that I work in, there's always something new that's coming on a day-to-day basis. So today we were talking about, it's actually ironic, we were talking about changes to the physician fee schedule that are going to impact 2025. Yesterday we were talking about what are we going to do to focus on a change in our pipeline based on where the pharma trends are going. So I think just the unpredictability is what I like. And that's one of the reasons that brought me to the startup side versus pharma, because, while the work in pharma is good and it's challenging, it's a little bit predictable, right? In some areas, especially if you're in a vertical area. So those are things that I would say to just look out for is, what do you want in your role? How much variety, and do you want to specialize, or do you want to be more generalist?
All right. Thank you, guys.
Absolutely. And Joshua, thanks. That was a fantastic question. And I know I enjoyed hearing those answers as well. And I think that the audience can kind of start seeing a thread throughout these answers about flexibility, about, things change, but be open. And don't worry so much. Don't worry so much about that linear pathway. I just kind of know that things open up for you as you go through the exploration of careers. So I know many of our audience members might be on the job hunt now, or internship hunt, or, they may be changing jobs at this point. But can you tell me a little bit about what your industry, company, or your folks in your role look for in a candidate?
Yeah, I'll start. So I'll speak from a startup perspective, and then I can speak to pharma. Um, so from a startup perspective, more of what we're looking for, especially in my area, which is more commercial, that includes market access and also the policy side, we're looking for essentially, like, this is going to be a basic term, but athletes, right? So someone that is flexible, that wants to learn a lot of different areas and is willing to jump in, because, with a team that is 4+ me, there's a lot of work to go around. So I look for someone that maybe doesn't know what they're looking to do, but they have a general sense for the type of skills that you want to build. And that's really what the type of person I want to work with. So I have one person on my team who, openly stated when we interviewed him that he had aspirations to launch his own company, right? And so he wants to be an entrepreneur. And so for me, I know the types of skills that he wants to build out and what would excite him. And that's where I put him from a day-to-day basis. Going back to the pharma days, and I'll touch on that real quick, what they tend to look for is someone that is a little bit more specialized in an area. So I'll tell you that from a market access perspective, we worked with a lot of students from Gillings, right? And we worked with a lot of students from Kenan-Flagler. So a lot of the background that you have in college helps to translate to that pharma career. Whereas, if you're talking about startups, especially in a growing area like mine, I'm looking for more of a generalist that may not be sure what they want to do, but they have a sense for where they want to go in general.
Well, say I'm in the throes of growing my team quite a bit here, and so today I had an offer go out, and I had a couple of interviews that my managers were doing, and we were reviewing them not too long prior to joining on. And so I won't repeat what Tony had to say about being an athlete and being flexible and bringing, kind of being a multi-dimensional candidate and employee. There's no two jobs that are ever going to be alike, and there's no 2 days that are ever going to be the same. And so you're always going to be pivoting and learning and growing. One of the things that we look for specifically in consulting that I would say is over-indexed, if you're thinking about a job in consulting or something similar, is your comfort with ambiguity and living in the gray space. We see that folks are like, I love wading through and figuring it out, and then it turns out they really want to jump to an answer really quickly. So if you're someone who's like, when I put down 1 + 1 and I want 2 and I want to sign off at 5 o'clock, consulting might not be for you. And I think that's just as important to know what's not for you as what is. But the comfort that you have with not knowing, if you're comfortable with drafting a hypothesis and going into rabbit holes and going and finding out, finding your internal subject matter experts and working with them to refine your hypothesis and eventually kind of your solution statement for the client, then consulting is a really good place to start to think about what you're going to do. I think the other thing, and we talked about it a little bit earlier this evening, and it goes along with it, being a lifetime learner. So you're building an awesome foundation at UNC, and you've got people on the line who are biased to that and biased to the education that you're seeking out. But never giving up on that intrigue and that excitement to go figure it out and to learn something new, to keep pace with your industry. One thing that our clients ask is they want to know, Julie, where do you think digital transformation is going to be next year? Julie, what are your other clients asking for when it comes to natural language processing tools? How are they using it? Are you seeing other states solve this problem? What have they been up to? So that willingness and natural inclination to be comfortable in ambiguity, work through a problem for quite a bit of time, and constantly be comfortable seeking out new information and being on a learning journey every day will set you up for a great career in consulting. And I say that as someone who's specific in our public health space.
Yeah, and I would agree with both those in terms of, even if you want to go into healthcare or thinking about hospital spaces, academic medical centers, clinics, more of that more provider service delivery side. I think one thing that we hear a lot is I know we're in this generation, and I'll say generation because I think I crossed like half of them by a year or two. So I have like one foot in the door on each side of our generation gap, or I'll say between millennial and Gen Z and maybe Gen X. I won't share my age, but I do think it's important that I've been told now, coming to your job in person, that is showing up. So what I actually hear most from people is, I want to make sure that, yes, it's okay if you work from home a few days a week. We totally support that flexibility, understanding, but sometimes we really need you to come in. Like if we do have clients, if we do need to make a pitch to maybe a really important stakeholder or a partner, that needs to be done in person. Because going back to that emotional intelligence and communication, again, people might not be verbally communicating with you, but their body language says it all. So one, show up, meet people. Like you can observe and learn so much in the healthcare space just by sitting in waiting rooms, just by sitting in cancer treatment centers and sitting with someone who's getting an infusion or they're getting chemotherapy. You listen, you watch what people are doing, you see their processes, and it's just amazing to absorb that information. And then also trying to see how patients are experiencing that environment as well. So one, don't be afraid to show up and just absorb it. And then two, I think this goes back even to consulting and even to startups. Do your homework. Like be okay to not know the answer, but learn enough to say, I can talk about this at this level, and then I'm going to need someone to probably that maybe has more advanced degree or actually has a PhD in this or a master's degree, or maybe they just have 20 years of R&D and they've been working for big pharma and they know what I don't know. So I like that idea of one, that lifelong learner and doing your homework and bringing that initiative. So I think that's something that, again, I love flexibility. I don't want to be in an office 9 to 5, Monday through Friday, but showing up does matter. And I think it's important for people to see you, know you, get to understand you, get to see your, verbal, nonverbal tactics.
Again, thanks for the very thoughtful answers there. And also I'm seeing, again, a big trend of what they would call soft skills. I think just wonderful. So that if that could say something to our audience to think about as you prepare and as you create those relationships that might lead to, job opportunities as well. I just have a very quick additional question. You talked a lot about skills. Is there anything that you can think of that you would have taken advantage of, like experiences or gaining certain skills in your undergrad or your graduate work that you didn't take advantage of that you really wish you had?
I'll be honest, in terms of what we offer our students now, data visualization. I mean, I can create tables, I can write code, I can put very boring numbers in tables, but if you make data become alive and people can understand it through a story, that is going to sell whatever you are trying to, again, if you're trying to get a yes, if you're trying to get a I'm open to this now. I wish, and again, when I was doing school and getting a lot of this done, things were out there, but I don't think there was this heavy emphasis on, storytelling with data and making it appealing and not just making it a turn off and not making it feel like a research paper. I can say that I have a lot of studies, so I've read them, and yes, sometimes I do fall asleep when I read my own studies, so it's okay. But again, making that story come alive so the data is helping tell your story. So use that to your advantage and making sure that, again, it's part of that communication of how do people resonate with stories and ideas. And I think part of that is making it something that they can envision.
So maybe this is an unfair response, but I think if I would have gone forward in a time machine, I would have learned a lot around AI automation. Because like this is like the hot topic right now, especially within smaller companies and startups. Any menial task that you can automate so that you can use your skills for more thoughtful exercises is going to be a benefit. So as much of that as you can absorb now, the better off you're going to be. And you're going to have edges over people like me that are just learning this right now. So, if there's things that that you can take off your plate easy to free up your brain for more higher level tasks, that's what I would recommend, that I wish I could have done in the past, but it wasn't available.
Yeah, we went the old-fashioned route back in the day, Tony, back in the day. I would say this, like, reflecting back on my time, I could not have taken enough finance classes to save my life. One of the things that I would really encourage you to do is you'll have a lot of jobs that are strength-based, right? Particularly as you advance in your career, your strengths are going to be where your promotions and growth come from. And they'll be what you love, but also use your education to identify where you think that you have weaknesses so that you can bring them up to a level so that they don't hold you back from a promotion. I would also say, you will have colleagues who are complement your strengths. What is your weakness will be the thing that gets them excited every day. But if you're going to sit with them at the table, you really do have to be able to sit with them at the table and understand what their job is. So if you're thinking about a career in healthcare management, or you are thinking about a job in consulting, or in pharmaceutical sales and marketing, or whatever the case may be, you're going to be at the table with your CFO one day, and you're going to need to be able to understand why the strategy makes sense for the finances and makes sense for the investors, and why the investors care about certain decisions and why the others are less important to them, and how they're thinking about the balance sheet and their own investment and continued investment in the firm. So I would say to be thoughtful of that, for sure, and to kind of think about how you want to go about that. The other thing is, know where you want to differentiate yourself and how you want to be your own unique offering in the marketplace. Where do you want to stand out and over-index a little bit of investment so that you stand out as a candidate, you stand out as an employee, and you continue to stand out as a leader in the industry that you're in.
Thank you again. Great answers. Corinna.
Hi, I'm Karenna. Thank you guys all for joining here and talking to us. I had a quick question. I know we talked about like what your favorite parts were, but what would you all say was the most challenging part of your career up to this date?
You want me to
Oh,
jump in first? Or
yeah, I
you
was
wanna
gonna
go,
say, I
Lindsay?
think we all unmuted at the same time. So
Go ahead, Lindsay.
the power of having similar response times. I'll let somebody go first, though, if you would like to.
No, go ahead.
I would say, gosh, most and just going back and saying most challenging, and just to confirm, it was the most challenging aspect, or maybe what's a little bit more challenging in my career, or our careers. I think in the day-to-day, when you are getting bogged down with a lot of requests, and I'm loving AI right now with how can I make things more efficient, but I think ensuring that if you are in this space, can you be one, deep in the weeds, knowing what's going on the ground, understanding that connection, but how quickly can you jump to a 50,000 foot view and say, okay, I'm going from day to day, and now I'm jumping to a meeting where we're saying, where do we want to be in 5 years? And so I think sometimes that can be challenging to be so in it with the processes, logistics, the technical components, but then being asked to say, okay, now let's think about 5 years from now, and only high level ideas, which I do love part of that, but it does take a minute, a little bit more for me to transition my brain into saying, okay, it's a different meeting, it's a different audience, it's a different purpose. So I think for me, just making sure when I go into a meeting, what is that meeting about? What is needed from me? What is expected of me? There are some times when you're just playing a minor role and people don't want to, you are not the main player of that role. And so I think also understanding when is time to speak up, and then when it's time to actually, stand a little bit down and just listen. So again, that goes back to a little bit of the emotional intelligence of trying to figure out, when do I speak up? When do I let others speak for me or speak on behalf, or they have something better to say and I know it? So that's what I'm going to say. Julie and Tony, I want to hear what your answer is.
Yeah, Lindsay, I think you took some of mine, which is good because I could build on yours. I think nowadays with things being Zoom based, at least my schedule is like back to back to back all day. And so carving out time for actual thought work and work that's going to benefit the pharma partners that we work with, or maybe cross-functional internal teams, is tough, right? And so what we've started to implement are do not schedule blocks. And so it's a couple of hours a day, maybe an hour and a half to 2 hours a day, where there's no meetings that are allowed. And if there's a DNS block, you can't put any meetings there. And the reason for that is because we found a lot of people, and I'm guilty of it as well, where you're multitasking, right? You're in a meeting, but you're really not there. And what we found was that the actual decision making within those meetings was like non-existent. And so by having these, I would say, if you can carve those out, those DNS blocks, that gives you the time to, like Lindsey was saying, well, you can pivot and think through what do you have to do to get ready for that next meeting. You can do thought work, right? And it's going to be something that makes your calendar manageable so that you're not working absurdly amount of nights and weekends, right? And so that's the biggest thing that I try to face on a day-to-day basis. So Lindsey, I really like where you went.
I'll pivot a little on this one. And I took two quick notes for myself, because it's getting later in the day and I think my memory is probably going. But the first one is, and I think this would cut across every industry and every job, checking your personal problems at the door and your personal challenges, particularly. I manage teams that are based here in Washington and teams that are spread throughout the country across the accounts. And the minute that I get to work, it becomes about them and not me. And I would say learning myself about what do I need to show up and be fully present to my team every day, so that they are getting everything they need, and reminding them, I'm here to enable you, I'm here to support you, I remove barriers for you, I connect you to resources, and just kind of making sure that in order to be present forward and in front of your team and for your team, that you have been really thoughtful about the things in your life that you need to make that true for yourself. And those will be things that are maybe not related to career at all. They'll be kind of your personal infrastructure, right? Everything from I'm on a soccer team to blow off steam to I have two friends who know what I do and understand the intimate details of why some days I have bad days at the office. The other thing that I would say that I found so hard, but I have really found traction on this year in my own career, is the ability to say, that's an awesome opportunity, but it's not the right one for me. And if you are a person who's like, I want to keep my foot on the gas, that's definitely me. I always want the next challenge, the next adventure, the next great opportunity. This year, I actually reshaped my client portfolio at the firm to be more specific, because even though that required us to kind of carve off a couple of clients and a couple of things in my pipeline and hand them over to other directors and partners, it allowed me in the long run to be set up to build the portfolio that I love leading. So in the short run, it was a decision that was thoughtful to pull back a little in order to ultimately accelerate and grow. And I don't think that that's a decision I would have ever felt comfortable proposing 5 years ago. And I would say I regret that. And I hope that as you're kind of walking through your own career, you'll be thinking about who's the leader I really want to be? What's the career that I'm growing, that I'm going to be excited for, and I'm going to show up for each day, and find the people in your life who are going to support you, encourage you, and enable you to get there. I'm grateful. Those people, some of them I work with, some of them I've picked up along the way in the adventures of life. But being able to be truthful and honest about where I'm going and what my strengths are, and what I'm most excited about has been freeing and rewarding.
Thank you so much. Oh, sorry.
Oh, yeah, no, sorry.
No, you're good.
Oh, terrific question. And again, it is 7 o'clock already. That flew by. This was an absolutely wonderful conversation. I just first of all want to thank our panelists. Thank you for just being so informative and really authentic with our audience. And audience, thank you for taking this time. I know it's late on a Tuesday night, but you also asked really poignant questions that were really helpful for understanding and just creating a wonderful conversation. So again, thank you all. We'll hopefully see you at our next fireside chat, which will be December 19th. So please look at the schedule. But again, thanks to everybody. We'll see you next time.